Hello and welcome back to Talk to Dr. Sisay's YouTube channel. I'm Dr. Aziza Sisay, and the video today is a recording of a live session that we had a couple of months ago where we discussed all things cancer screening with a particular emphasis on cervical screening. Now, cancer screening is so important. It literally saves lives, and in some cases, like in cervical screening, it can actually prevent cancer from occurring. So I hope that you find the video useful. Without further ado, let's get to it. Length. Okay, so I said we're going to be talking about cancer screening. Now, as I say, this is a really important topic and one that can literally save lives. I'm going to try and talk through things at a very basic level so that you have the understanding. And I'm hoping that through this discussion, you become well informed and hopefully you decide to attend the cancer screening because genuinely, as I say, it can really save lives and it has saved lives. Okay, so we're going to be discussing the overview on cancer. So what cancer is, why it occurs, and how it occurs as well. We're going to talk about cancer screening and what the available cancer screening programs are. Because I'm UK based, I'm going to be focused on the UK cancer screening programs, but it is similar in several different parts of the world. And also, I'm going to elaborate on each cancer within the screening program. As I say, because there's not that much time, today's focus will be on cervical screening. Okay. Now, for the men who are watching, please, please, please pay attention. Don't switch off. This is really important. I'm sure you have female loved ones that you care about, and perhaps through the knowledge that you gain from this, you can encourage them to attend cervical screening invitations. Okay, so we're going to discuss what cervical cancer is, what the risk factors are, what the symptoms that may occur are with cervical cancer, what the screening process entails and who gets invited, and what the results mean, and then what happens next. Okay, so what is cancer? So cancer is when cells in our body become abnormal and divide to make more abnormal cells. Now, we have trillions of cells in the body, and the body works in such an intricate way. It's quite ordered, the process. So you have cells which divide according to the body's needs, gradually and in an orderly fashion. However, there's some times where the cell will divide and they will form abnormal cells. So if you look on the screen, these red cells are representing abnormal cells. But the body is usually quite good at picking these up, and they get rid of them or they repair them. However, as with anything in life, sometimes these can get missed. And when these happens, that's how cancer develops. So these cells don't have the same order or programming as the normal cells. So they divide quite erratically in an uncontrollable fashion. And when this happens, they invade the cells nearby, and then they can even form a growth. And eventually they start to invade distant areas, so they can invade other organs in different part of the body. And that's when we say metastasizing. So that's what happens with cancer. So why does cancer occur? So it can occur because of genetic factors. So when we say that, we mean, for instance, that you've picked up genes from your parents that were faulty, and that makes you more prone to developing cancer. And then there are external factors as well. So these are chemicals, for instance, tobacco and cigarette smoking that can cause damage to cells, or asbestos in the previous work environments, UV radiation, including the sun rays, and different infections as well. We'll talk about HPV, human papillomavirus, in a minute, and hepatitis, which can cause cancers. And then age, unfortunately, as with a lot of things, as we get older, it does increase the risk of developing cancer. So a bit of statistics. Cancer is the second leading cause of death globally. It's responsible for an estimated 9.6 million deaths in 2018. And that accounts to 1 out of 6 deaths. So that's quite a lot. Approximately 70% of these deaths occur in low and middle income countries. And this can happen for several reasons, some of which is the fact that they don't have the facilities to help to pick up cancer, so screening, that sort of thing. Also, they may have limited health knowledge or health awareness, and they don't know of what symptoms are associated with cancer. And so they usually present late when the treatment options are limited, and they have a poor prognosis, which means the survival rate is low. The number of new cancer cases are on the rise globally, and they think it's because of twofolds. One, because the population is getting older, so we're an aging population. And the second thing is that we're becoming more and more exposed to cancer-causing chemicals within the environment. So about 30% of cancer deaths could be avoided by a change in lifestyle and more healthy behaviors. So that's really significant. This is where we push towards leading that healthy lifestyle, because you can change the course of cancer occurring within your life. All right, let's talk about the prevalence, so how common cancer is in the UK. So in the UK, it is thought that 1 in 2 people will get cancer in their lifetime. So that's 50%. There are around 367,000 new cancer cases in the UK every year, and that approximates to 1,000 diagnoses of cancer a day. Every 2 minutes, someone in the UK is diagnosed with cancer. And almost half of these cases are diagnosed at a late stage, which, as I said before, means that you get a poorer prognosis or lower survival outcome. And I'm not saying any of these things to scare you. It's just to emphasize the severity of the situation and why we need to tackle it, and screening is important, because cancer really doesn't care. It doesn't care how old you are. It doesn't care where you're from. It doesn't care what you own, whether you're rich or poor, what you do. It can affect anyone. So let's talk about cancer screening. Cancer screening involves testing apparently healthy people for signs of disease. So these are people who don't have any symptoms at all. It helps to spot cancers at an early stage when treatment is more likely to be successful. So in some cases, like with cervical screening, it can actually prevent it from happening altogether. And some of the most common cancer types are largely curable if they're detected early and treated appropriately. And this is where cancer screening comes in, because it helps to detect cancer at early stages. So in the UK, nationally, there are 3 cancer screening programs. So you have the cervical screening, you have the bowel cancer screening, and the breast cancer screening. Now, before these were released or rolled out, they had gone through quite extensive assessments to make sure that they were safe and effective. And this is why there are currently only 3 in the UK. In the US, there is also a lung cancer screening, but in the UK at the moment, these are the only 3 that are safe. They're quite stringent rules before they're rolled out. So this is why I encourage you to go, because they have done the testing to ensure everything is okay and safe with cancer screening in the UK. So why is cancer screening important? So it may help prevent cancer by finding changes in your body that would become cancer if it was left untreated. Now, if you diagnose cancer early, the positive is that you get the better prognosis, so a higher survival chance. Also, you pick it up before the cancer spreads. And in this way, when you pick it up early, it means that you need less treatment. That also means that you have less time spent recovering. That's the hope. And finally, cancer screening helps to reassure you that everything is okay. So if you've done this screening and it's come back negative, it usually means that everything is fine. Now, having said that, as with everything in life, there are shortfalls with cancer screening. And I know I just said it's good, it reassures you. However, there are some instances where you can get false negatives. So what that means is that where you've tested negative, but actually you may have cancer. And when we say that, what you need to remember is we encourage people to come in if they're getting symptoms. So for instance, if you've tested negative, but you're getting symptoms and you're concerned, I would say go and see your GP so they can do the extensive investigation to rule cancer out. So don't be reassured that, oh, okay, it's negative, but I have symptoms, so I don't need to get checked. You do, please do. And then when you talk about other shortfalls, you have the false positives. So this is where you're tested as positive when actually you don't have cancer. And this can obviously cause a lot of psychological distress, and it can cause a lot of issues and unnecessary investigations and testing. But unfortunately, this is a shortcoming of cancer screening. And then you can also have overdiagnosis happening. So what that means is where you get diagnosed as having cancer, but it would have been a slow growing cancer that might not have caused any long-term effects. And that would have meant that you would have more investigations, more surgery, when it wouldn't have necessarily been important to be done. So it could also mean that you may, you may also have other shortfalls, which include getting more testing and more procedures, which could be harmful to you in the long run. Now, it's all about weighing the pros and cons, weighing the risks versus the benefits. So usually with cancer screening, as I said, because they've done quite extensive investigations, the pros will outweigh the cons. So the benefits would outweigh the risks. Now let's talk about reasons why people don't attend their cancer screening appointments. So it could be because of fear of the unknown, and I completely understand this. It's scary. You don't know what could happen. You don't really want to know if you have cancer. And like the saying goes, ignorance is bliss. But like I always say that ignorance is bliss, but it is until it can actually shorten your life expectancy. Other reasons people don't attend is because of poor understanding and individual health beliefs. So things like, oh, I'm too young, I won't get cancer, or it doesn't run in my family, so it's fine. I'm healthy, what's the point? Why should I go looking for trouble? And then in some instances, like people of Black people, Asian, or ethnic minorities, they are quite suspicious with these sort of screening procedures based on the history of getting tested unethically. And that's another reason why they don't want to attend. Another reason could be embarrassment and discomfort. So some of these procedures can be quite intimate, and people find it embarrassing. And also it can be uncomfortable for some people, and they may have experienced a lot of pain in a previous appointment, and so they don't want to attend again. Again, language barriers. So some people don't quite understand what's going on because of language, and so they decide not to attend. If they receive a letter in English inviting them to come for cancer screening, they won't understand what's about, so they won't come in. And finally, other reasons include access. So for instance, when we talk about cervical screening, it's been found that disabled women, 63% of them are unable to attend their cancer screening appointments. And this is because they don't have the access facilities, there aren't the equipments necessary to get them done. And in the UK, the screening procedure is affordable, it's free, right? However, in the States and other countries, you have to pay for it, you have to have insurance. So if people can't afford it, they won't attend. And finally, it's just the fact that people have quite busy lifestyles, so that you find it difficult to book in appointments for their screening, and so they don't attend. Or some people don't even get the invitation, so they don't realize that they have to go. Okay, so we've talked about broad cancer screening. Let's talk about cervical cancer now, specifically. So in order to talk about cervical cancer, let's try and understand the anatomy, the female reproductive anatomy, okay? So this is just a diagram, a smaller diagram of what you would expect, where it's located, the female reproductive system. But if we make it bigger, these are your ovaries on both sides, and then you have the fallopian tubes, and then you have your uterus or the womb, and then this area here is called the vagina. But this area is where your cervix is, okay? So that's the area that the cancer would occur most likely here, which is known as the transformation zone. I hope you guys are looking at the screen. So this is where cancer usually starts off, and it's found when they have cervical cancer. So cervical cancer is when abnormal cells in the lining of the cervix grow in an uncontrolled way. Now, it's the fourth most common cancer in women worldwide. And over 3,000 women are diagnosed with cervical cancer in the UK. So that's 8 cases in a day, every day. And there are 850 cervical cancer deaths in the UK every year. And that actually accounts to 2 deaths a day, which is really scary and quite unfortunate because actually it's one of the most preventable cancers. They say that 99.7% of cervical cancer is preventable. Okay, what are the risk factors of cervical cancer? So not attending cervical screening is a big risk factor, and this is because you aren't picking up any cancer cells or potential cancer cells early enough. You don't pick up cervical cancer early either. And then another big factor is a virus called human papilloma virus. Now, this is actually a very common virus that a lot of people get infected with, and it's usually okay. 8 out of 10 people would be infected by this virus in their lifestyle, and they'd be none the wiser because the body would usually fight against it. There are 100 different types of these viruses, but there are 13 of them that are linked with cancer, and they include type 16 and 18. You usually get this virus through skin-to-skin contact, and it gets to the cervical area through sexual contact. So it's usually associated with people who have had intercourse quite early or sexual activity at a very early age, or people who have had multiple partners, or even people who don't use condoms. Other risk factors include using the contraceptive pill for more than 5 years, smoking. It's thought that women who smoke are two times more likely to have cervical cancer compared to women who don't smoke at all. And then genetics. So if you have a first-degree relative who has cervical cancer, so when I say first-degree relative, I mean either your mom, your sisters, or your daughters. If they have cervical cancer, it increases the risk of you developing it yourself. If you've had a previous history of cancer to your kidneys, urinary tract, vulva, or vagina, that increases your risk as well. It's also associated with women who've had 5 full-term births, so 5 children, more than 5 children. And it's also associated with other STIs, so other sexually transmitted infections like chlamydia is known to increase the likelihood of you being infected with HPV. Other risk factors include being overweight or obese, being immunosuppressed. So when I say immunosuppressed, all that means is your immune system is what helps you to fight against infection. So if your immune system is suppressed, it means that you're unlikely then to fight against infection. And this can happen because of infection, so HIV, which is an immunosuppressive condition, or there are certain medications like azathioprine or immunosuppressing medications for patients who've had kidney transplants. They are all at increased risk of cervical cancer. And then women whose mothers took a medication known as DES. So this was one that was given for fertility. They don't give it anymore, but the women whose mothers took them are still alive. So they are at increased risk of developing cervical cancer. And then women in low and middle income countries. And this, as I said before, has to do with the lack of facilities, lack of awareness, and they actually account to 85% of the cervical cancers that occur worldwide, which is really quite sad. I want you to know that the reason I spelled women with an X is not just spelling mistake, it's because it includes women who identify as men as well. So transgenders are included in this. So anyone who has a cervix has these increased risk of developing cervical cancer. All right, so what are the symptoms associated with cervical cancer? Now, if you have unusual vaginal bleeding, so this includes bleeding during or after intercourse, if you're bleeding in between periods as well, and after menopause. So if you haven't had a bleed for over 12 months and you've been confirmed as having menopause, and then you start bleeding, then that's a concern. Pain or discomfort during intercourse is usually associated with cervical cancer, unpleasant vaginal discharge, pain in the hip area, the hip bones. Those are all associated with cervical cancer. However, having said all of that, these symptoms can occur even if you don't have cancer, but it's just worth noting that they're really important that you see your GP to have some further assessment investigation so we can rule it out. And then it's really important to note that in the very early stages of cervical cancer, many women don't present or don't have any symptoms at all. And that's why screening is so important, because usually if you do have symptoms, it's a late sign. So cervical screening is also known as having a smear test. And it's a test done to help prevent cancer. So it's not a test to find cancer, it's a test to prevent cancer. So it checks the health of the cervix. And more recently, in the last couple of years, what they do is they test for high-risk types of HPV. And depending on the results, they then check for any abnormal changes in the cervical cells. And in the UK, the screening program is estimated to save 5,000 lives a year. 24% of cervical cancers are detected by this cancer screening program. So it's really, really important. So who gets invited in the UK? So women between the ages of 25 to 64 are invited for cervical screening. In the US, they start a bit younger at 21. And it's basically anyone who has a cervix, then they should be screened. So this is a quote that I got from Cancer Research UK. If you have a cervix, then cervical screening is for you. Now, in order to be invited, you must be registered with a GP. So it's really important that you're registered with a GP. So if you're aged between 25 to 49, you are invited every 3 years. And if you're aged between 50 to 64, you're invited every 5 years. Now, if you're older than 64, but you've never had screening before, you can request for your GP to organize for you to have a screening done. So it's either done at a GP surgery, or it can even be done at a sexual health clinic. Okay. It's important to mention that 1 in 4 women fail to attend the screening appointment. And this again is part of the reasons that I mentioned before, because of health beliefs, because they don't have the understanding of why screening is important. It could be because of access, like I said, with disabled individuals. And also it's more common, it seems to be more common in women of Black, Asian, and ethnic minorities, because of again, the lack of understanding and the awareness. And there are lots of women who also are within like strong religious groups, or who've only had one partner, who don't think that they need to be screened because they don't think that they're high risk. So I'm hoping that through this discussion, open your eyes and encourage you to attend if you're not one who attends, or at least to encourage you to continue to attend. Okay, so what does a smear test entail? I thought it would be really important to show you the equipments that we used for smear tests. Now, if you're someone who would rather not know what things look like, then that's absolutely fine. Please don't look at the screen for about a minute. But for those of you who are interested, we use a device known as a speculum. So what happens is you get invited and you usually see a nurse who explains the procedure to you, and then have you go onto a bed, and they'll tell you to undress from your waist down. And they usually give you a sheet just to cover your hip area. And then they use a speculum. So this is a normal size speculum. This is the one that they would usually use in the first instance. However, there are other sizes. So for instance, if you're someone who gets a lot of pain and discomfort, they can try you on the smaller size, which is this one. So just for comparison, this is a smaller size speculum. It's the smallest one. Or if your cervix is quite deep, and some women do have quite a deep cervix, they use the biggest one, which is that size. So this is just to make you aware that there are different sizes available. So you can mention it to your nurse if you are a bit nervous about having this smear done. So they would lubricate the area, and then they would insert the speculum like this into the cervix, turn it, into the vagina, and then turn it around this way. And then they open it up so that they can see the cervix. And once they visualized it, they then roll this bit here to keep it still. And they use this device, they use the brush, which is this, and they insert it into the speculum. And then once they get to the cervix, they turn it around a few times so to make sure that they get enough of the cervical cells. And then once they take it out, they then put it into this tube, this container that has a bit of liquid in it, which preserves the cells. And then they sort of shake it around to make sure that they get enough of the cervical cells into this solution. And then they send it off. Now, just to illustrate, the area that the brush goes into is just about here. So that transformation zone that I told you about, where cancer usually develops. Now, you usually get the results within 2 to 6 weeks. And I want to stress here that GP surgeries are doing the smear testing, even through this COVID period. So please, please book the appointment. Don't delay it. Yes, the results may take a little bit longer than usual to come, but at least you've had it done. Okay, so I wanted to discuss what happens when you get a result. Now, please follow me along. We'll do things in an order. So as I say, they test for HPV in the first instance. So if they check and they don't find any HPV, then you go back to the routine recall, which is every 3 to 5 years, depending on the age, yeah? If they find that there is HPV, but they don't see any cell changes when they look at the cells, then you go to the 1 year recall, which means that you're invited back in a year, okay? When you get invited back in the year, 3 things can happen. Either they don't find any HPV anymore, and then they take you back to the routine recall, or they may find that you have HPV that's persisting. So what they'll do is they'll call you back in a year's time, and if HPV is still found, but there are no cell changes, then they send you off for colposcopy. So I'll talk about that in a second. Or if they do the first year recall and they find HPV with cell changes, right? Then you go for colposcopy. So if they find HPV with cell changes, they always send you off for colposcopy. I hope that makes sense. If it doesn't, we can discuss it again in the question and answer section. So colposcopy is a procedure where you get invited to a specialist clinic and the cervix is examined. Similar way, they use a speculum to open up so they can see the cervix, but they use a microscope, in order to visualize the cervix better. And then they use a liquid as well so they can highlight any abnormal cells and so on. And depending on what they find, they'll treat you. Now, the problems that can happen with the results include you may get a letter saying that there was an inadequate sample, and all that means is they didn't get enough of the cervical cells to confirm the results. Sometimes you may have an infection or inflammation of the cervix, which again can affect the results, so they can't confirm. Or the patient was on their menstrual cycle. Now, just to mention, women have this procedure done when they're not on their period. However, there are some times where perhaps, you may have been, the woman might have been close to the time of her month, and as soon as the speculum was inserted and the brush was inserted, she'd start bleeding, so that affects the results. So yeah, they are unable to confirm the results because of the blood, and they wouldn't be able to visualize the cells well enough. So when this happens, they then invite you to go back in 3 months' time, okay? All right, so we're reaching the end of this talk. Thank you so much for being patient and for listening this far. I really, really hope that you found this useful. Let's talk about HPV vaccine, which is really, really important, and how it helps to prevent cervical cancer. Now, we've spoken about HPV. We said that it plays a crucial role in the development of cervical cancer. And in fact, over 99% of women who are diagnosed with cervical cancer are found to be infected with HPV. So the link is it's too close. So the vaccine works by protecting against HPV infection. And in this way, it means that if you get exposed to HPV, your body has the right immunity to fight against it so you don't get infected. So they're offered to girls and boys aged 12 to 13. So they have been offered to girls between 12 to 13 since 2018, and they only started offering it to boys last year. And it's done in 2 doses. So you get your first dose, and then after 6 to 24 months, you need to have your second dose. The vaccine isn't effective if you haven't had 2 doses. Women under 25 who are eligible can ask their GP to have the injection on the NHS free of charge as well. So a recent study, and when I say recent, this is literally, it was only released a couple of days ago. It was published in a New England Journal of Medicine, and it concluded that the risk of cervical cancer by age 30 was 63% lower in vaccinated women compared to unvaccinated women, which is quite a significant number. So this study, how it worked was they followed 1.5 million Swedish girls and women between the ages of 10 to 30 over the course of 11 years. And then they checked their cervical cells, see if they were diagnosed with cancer. And they found that it was 63% lower in vaccinated women versus unvaccinated women. Okay, we're done. We've reached the end of part 1, cancer screening. So I always end with a take-home message. And for today, it's just to say that you need to know what's normal for you. Understand your body. If something doesn't feel right or there's some new changes, go and speak to your doctor about it. I mean, you could get investigations done and hopefully you can be reassured. So yeah, seek further guidance from your doctor if you're concerned about something. Please attend your cancer screening invitations. I'm really, really hoping that through this discussion, it's at least given you, some insight and some encouragement to attend if you're, not someone who would have wanted to. And also, it's all about a healthy, balanced lifestyle. As I say, they have estimated that 30% of cancer can be prevented just by leading a healthy, balanced lifestyle, not smoking, reducing alcohol, making sure that you're not overweight or obese, exercising, having a healthy diet. All these things can change the outcome and it can change your life. So thank you so much. Oof, there was a lot to cover, but I hope that you found that quite useful. I wanted to make sure that we covered the majority of the bases so that you can make an informed decision when figuring out whether or not to attend your cancer screening appointments. And I hope that it's given you more of a reason to attend. Now, we have another live recording that's coming up soon, so stay tuned. Don't forget to like, comment, and subscribe. We'll see you again soon. Thank you so much for watching.